Regardless of the stage of the oral cancer you are in, let it be stage 1, stage 2, stage 3 or stage 4, surgery is going to be an integral part of your treatment plan. Of course, there are going to be some exceptions. In this video, I will be taking you through A to Z of oral cancer, right from diagnosis to treatment to the follow-up. Hi, I am Dr. Pradeep. I am a consultant oral and maxillofacial surgeon with special interest in treating oral cancers. I have around 7 years of experience in treating oral cancers. So let's start with the diagnosis. So when you have a doubt that you have oral cancer in your mouth, so how do we go about? So when you come to a hospital, how we start is we do a complete thorough physical examination. So we check your mouth, we check up to your throat, sometimes you also check your lymph node status, that is the neck. So we get a fair idea of what it is. So when we have a doubt about oral cancer, how do we proceed? We do a test called biopsy. A biopsy is nothing but a small sample of tissue is taken from the tumor site, and that will be sent to the histopathology lab. So what we get as a result of this biopsy? We will be able to tell what sort of the lesion it is, whether it is cancer or not. And secondly, if it is cancer, what type of cancer it is. So we will get all the details about the particular lesion where we have biopsied. Most of the times in oral cancer or oral cavity per se, the most common oral cancer is the oral squamous cell carcinoma. Of course, in the rest 10%, there are a lot of other cancers which arises from other part of the mouth. But most of these squamous cell carcinomas, they arise from the lining of the mouth. So this will give us the diagnosis of the cancer. Next step, what we will be doing is the imaging. So imaging can be done either as a PET scan or PET CT scan, along with sometimes we do PET CT scan, or sometimes we even do a simple CT or MRI scan along with a CT chest. I will brief you about what and why we need these scans. So what is a PET CT scan? A PET CT scan will tell us a detailed analysis of the patient from in terms of the extent of the tumor, in terms of whether the disease has spread to the lymph nodes or not, or whether the disease has spread to other parts of the body, all in a single scan. And when it is fused to a CT scan, we'll also know how the extent of the tumor it is. The same information we will get even through a CT or MRI scan, and along with that we also do a CT chest sometimes to know about whether the oral cancer spread to the other part of the body. Why we do only CT chest? Sometimes we know that it doesn't extend. Most of the time the oral cancer goes into the lungs before it spreads to the other part of the body. So finally, how do we do it is either a PET CT scan or a CT or MRI with a CT chest. So with this we will get the diagnosis of the cancer. Next is the staging, what we call it as a clinical staging. Why it is important? Because your treatment plan depends on the staging of your cancer. So it also helps us in the communication between the doctor colleagues. So how do we stage it? It is all depending on your imaging features and our clinical examination. So how, based on the extent of the disease, if the disease is involving any structures nearby, or if the disease is going on to the lymph nodes in the neck, or if the disease has spread anywhere else, all these details will be recorded in the form of a staging. So this staging is now, how do we do it is in stage 1, stage 2, stage 3 and stage 4. This will give us a fair idea of how to go about the treatment plan. Now let's see what are the different modalities of treatment of oral cancer. The main modalities are the surgery, the radiotherapy, chemotherapy, targeted therapy and immunotherapy. These are the various forms or modalities of treatment which we use in most of the cancer. When it comes to oral cancer, the treatment is based on the stage of the cancer. So let's see stage 1, stage 2, stage 3 and stage 4. In stage 1 and stage 2, it's depending on the stages. So in stage 1 and stage 2, we have single modality treatment, that is either surgery or radiotherapy. But in worldwide, a lot of cancer doctors will agree that in the oral cancer, or specifically to the mouth cancers, the surgery remains a mainstay of treatment, though radiotherapy can also be. When it comes to stage 3 and stage 4, multi-modality treatment is the treatment of choice. So where we start with the surgery followed by radiotherapy, and whenever required, chemotherapy will be added to it. So in this section, let me explain the various types of surgeries that we do for oral cancer. Once you have a diagnosis, your doctor would have given you the entire treatment plan with a detailed explanation of what type of surgery it is going to be. So I will explain it to you, a certain words what we use in surgery and what it exactly means. The first is a wide local excision. Wide local excision means we remove a part, the entire tumor along with 1 to 1.5 centimeter of normal tissue all across the tissue, along with the three-dimensional and the deeper aspect also. This will allow us to clear the entire cancer in total along with the cuff of normal tissue all across. This is what we call it as wide local excision. The next is, if at all if the tumor is sitting next to the bone or if it is involving the bone, we have certain other terms and procedures which we do. If the tumor is close to the lower jaw, then we remove a cuff of bone from the lower jaw, what we call it as marginal mandibulectomy. Sometimes if the tumor is involving the lower jaw, then we do something known as segmental mandibulectomy, where we remove the entire segment of the lower jaw. The same applies to the upper jaw. When the tumor is close to the bone of the upper jaw, then we do remove a cuff of bone, which is called as a partial maxillectomy. But if the tumor is involving most of the upper jaw, then we do a surgery called total maxillectomy. So wide local excision along with either marginal, segmental or partial or total maxillectomy. Then this is the treatment for your primary tumor. Next stage of treatment, in the same surgery, we will be addressing the lymph nodes in the neck. Why we have to do a lymph node dissection? Even when your scan says that there are no involvement of lymph nodes in your even if it's a stage 1 or stage 2 cancer, we have to proceed and do a neck dissection surgery for all the oral cancers. Why is it? Because oral cavity cancers are known to have 30% occult metastasis. Means 30% of the time, even an imaging cannot pick up a small cancer cell that will be spread to your lymph nodes. That is the reason why we need to do a neck dissection surgery for any of the oral cancer, regardless of stage 1 to stage 4. Coming to the third part of the surgery is the reconstruction. So whatever we removed from the mouth, we have to replace it back as much as possible, like what we call it as like with like. For example, if we remove the bone, we have to replace the bone back. If we remove a soft tissue, we have to replace the soft tissue back. So this is done in conjunction with, in collaboration with our plastic surgeons. So in oral cavity cancers, not always we need reconstruction. If it's a very, very small tumor, for example, if it's a tongue tumor which is involving less than 1/3 of the tongue, then we may not do a reconstruction. We just do simple primary closure of the disease. But in case of a larger removal of the tongue or larger removals of the jaws, it will need reconstruction. So it will be done by the plastic surgery colleagues. It can be taken from any part of the body, what we call as free flaps. It can be taken from the hand, it can be taken from the thigh, it can be taken from the leg. Those tissues will be taken, and for those tissues to survive, we need blood supply and the nutrition to those tissues. How does it come? When these tissues are sutured to the mouth and their blood supply is connected to the blood supply of the neck through a process called as microvascular anastomosis. In this way, the tissue which we have taken from the leg or the thigh or the hand will get the blood supply from the neck and it will survive. So this is how the details of the surgery goes. Now that we have seen about the surgery, let's delve into how the post-operative recovery phase is. In the post-operative period after a oral cancer surgery, there will be some tubes in your body. For example, there will be a tube in a neck, which we call as a drain. So whenever we do a neck dissection surgery, naturally there will be some amount of fluid that will be collected inside, which will prevent the wound from healing faster. So that's why we keep a tube with a negative pressure, so that a tube will suck out all the fluids from inside. So whenever the fluid level goes down in that bottle, we'll slowly remove that tube over a period of time. Another tube that will be you will put on will be a Ryle's tube or a nasogastric tube that will be put through the nose into the stomach for you to have adequate nutrition during the post-operative recovery. Since we do the surgery in the mouth, there will be certain amount of difficulties in the immediate post-operative phase. So this Ryle's tube will help us to provide you with adequate nutrition for you to come out of surgery faster, recover faster, as well as it will help us in keeping the mouth clean and helps us in preventing infections. The other tube will be a urine tube. If at all if a surgery goes beyond 3 to 4 hours, we will be putting a small urinary catheter which will be eventually removed in 1 or 2 days time. Sometimes if it's a prolonged surgery where we do a microvascular reconstruction with a plastic surgery team, or when we do an extensive resection of your tongue or jaws, that is the time which we need to have a small tube, a breathing tube or a tracheostomy tube, which will again be eventually removed over a span of your post-operative recovery time. So typically your post-operative hospitalization days will range from somewhere between 2 to 3 days to up to 7 to 10 days also. Again, it is all depending on the amount of surgery or the type of surgery which we do. If we do a simple surgery with a minimal reconstruction, then we will be able to go back in 2 to 3 days time. If it's a major surgery with a free flap reconstruction, then you'll have to stay in the hospital for 7 to 10 days time. Once we are discharged, you will be all out of tubes. What you need to take care at home is another important thing which we are going to talk about now. So now that you are getting discharged from the hospital, I want to tell you certain important points to take care at your home. After your oral cancer surgery, once you are at home, one important instruction your doctor would have given is to keep your wounds clean. So it is mandatory that you have to take bath and use a lather of soap on the wound and clean the wound on a regular interval so that your wound remains clean. Same applies to your mouth. Keep your mouth clean. You have to use a mouthwash diluted in water every 6 hours so that the wound remains clean. This is of utmost importance to prevent any wound infection. And you will be given certain orders whether what all you can take by mouth in what different consistencies, and this is also be given in conjunction with your swallowing therapist who will help you out with the swallowing. It is again depending on how much extent of surgery we do. We do a bigger surgery, then we will have a consultation with a swallowing therapist. They will help in your feeding patterns and how you have to go about with your feeding. Medications, whatever your doctors have suggested, you have to go through your medications. Now that you have taken care of yourself at the home, what will be the next step? Your doctor will be calling you for the immediate post-surgical follow-up, and that is the time you will be receiving your histopathology report. That means whatever we have removed during the surgery will be sent to the testing to the lab. This report will give us the final staging, which is called as the pathological staging. This staging will determine whether you will need any further radiation therapy or not. Sometimes based on these reports, we may add chemotherapy to the radiation therapy. If at all, if you require radiation therapy, it has to be started within 5 to 6 weeks post surgery, provided your wounds are healed completely. Next, let's see about the follow-up. Whenever you have oral cancer, you got treated, you have done all the treatment as possible as advised by your doctors. Now comes the time of follow-up. So oral cancers, it is mandatory to have monthly follow-up for the first 1 year, following which the follow-up intervals will be reduced like 3 to 6 months, that your doctor will decide. So for the period of 5 years, you have to be on follow-up, where the first 1 year remains to be extremely critical, and you need to be on 1 month follow-up for the first 12 months. Now that you know all the details about the diagnosis and the treatment of the oral cancer, whenever you see any sign or symptom, please feel free to contact your nearest doctor immediately. And always remember, oral cancer is curable if detected early. Thank you.